Hey guys, welcome to my video on the EMT bag that I use as a volunteer EMT. This is a basic bag. This is my personally owned bag that I keep at home or take on road trips or even do volunteer activities with. Now down at the department, they have medical bags on each vehicle or apparatus. So this is just the one that I use, and it's closely aligned with with the products that the department uses and that I'm familiar with. The bag is a StatPax med slinger, and it's designed to just be tossed over your shoulder so you can carry this basic bag into a call and have your hands free to manage other equipment, whether it be O2 tanks or a med kit or some piece of transportation or immobilization device. It has this fabric on here that's easily cleaned and disinfected, and it even at the bottom it's reinforced for where you would typically sit it on the ground. It also has nice reflective strip right down the middle of the outermost pocket. One of the things I wish was included with this bag is some sort of a like a tab here that you could connect a leash to, because these shears just fall out pretty easily. If you keep the bag upright or laying flat, they stay in no problem. If it gets moved around inside of a vehicle or you're just taking it from place to place, sometimes you bend over, you twist, turn, whatever, these will just come out. All right, starting in this first compartment, I like these pull tabs, and one of the other things I wish they incorporated into this bag was these pull tabs on the inside of the bag. I'll show you that in a moment. So in the outermost pocket, or number one pocket as I call it, I keep a headlamp, and I carry two different size gloves. The blue ones are extra large, and that's just how I signify glove size. Blue is extra large. The tan color is going to be medium. I wear a size extra large gloves, so these are mine. If I'm working with someone who wears maybe a small or a medium, I'll have an extra pair for them. Continuing with PPE, I also keep in this pocket an N95 respirator that's vacuum sealed inside this packet. And this mask would be for me as the provider when responding to a patient with a potential infectious disease. I then also carry a standard surgical mask or ear loop mask, and this would be for the patient to keep their droplets from going any further than the mask here. And then this would protect me prior to putting this mask on them, or if somehow the mask failed. Next in here, I just carry just a small little pouch with Band-Aids of different sizes and shapes, and as well as antiseptic wipes and some just minor medications. You're out volunteering as an EMT and someone comes up and asks you if, like maybe you're at like a community event or a church event or something along those lines, and someone's like, do you have a Band-Aid? And you're like, no. And here you are with this bag full of stuff. So I just keep some basics, Band-Aids and just antiseptics inside this little bag here. And then the last thing in this pocket is just a little miniature roll of duct tape, just in case I need to make a repair on something. And I've actually used that a lot. I've had people come up to me and at different events and just ask for if I had any duct tape, and I did. So, all right, moving to the next pocket. This pocket here I call the trauma pocket. First thing we'll discuss in this pocket is going to be another set of trauma shears in case the ones on the outside are misplaced. I'll also have a set in my pants pocket. I then have two tourniquets inside this pocket, and these are out of the packaging and folded the way I like them to be folded so I can deploy them rapidly. And this is a whole separate video as to why I fold them the way I do. People have different reasons and techniques for folding a tourniquet. When I was in full-time law enforcement, we carried ours folded up real tight and small, and they were velcroed together, and it just basically is a smaller form factor on your gear. When you have an EMS bag, you can keep them a little bit bigger, but you also have more versatility in the way this is folded. If you're interested, I'll do a video on that. In this top pouch, this is where I keep my wound packing material. On the very top, I keep combat gauze. This is a hemostatic agent which encourages clotting for someone who's having some type of hemorrhage. So that's the first thing in this pocket. I'm gonna pull this back so you can lay things out. And then I have several compressed gauze rolls in here, and this can be used for wound packing as well. It can also be used to bulk up the hemostatic dressing if you need it. Basically just putting in more dressing on top of this if you run out, and then bulking it up on top. So when you place your compression bandage on top of it, you'll be able to get a good pressure wrap around the wound area. So I carry two 6-inch compression wraps by North American Rescue, and I also carry a 4-inch flat one. And the reason I do that is, number one, this is a bag, I have room for it. Number two, different size patients or different types of injuries. And sometimes a wrap of one size may just work better on a wound than the other. And yeah, again, you can make a lot of things work, but it's good to have options if you've got the space for it. In the clear pocket over here, and this is where I wish, this one I just keep unzipped because I have all the compressed gauze in here and I want to be able to get them out quickly. But I would like if they would put these pull tabs on at least the clear pockets. So in the clear pocket here we have a pair of hyphen chest seals, and I have two different sizes. I've got the full-size chest seal and I've got the compact chest seal. And again, this is for different size patients. You might have someone who's normal adult size to large size, and this will work well on them. You might have someone who is small and petite, or maybe a child, and this maybe work better on them. And the reason I mention that is basically when you apply this, you want it to be as flat as possible on the person's body. And it comes in a pair, so you have an entry-exit wound in each one. And this is something that we would use primarily if someone has a penetrating chest trauma or some type of penetrating trauma to anywhere in their thoracic cavity. I also keep a roll of tape in here. So if maybe you open this too fast and you go to pull off the plastic cover on the adhesive, and next thing you know the chest seal folds up on you, it's done. Just toss it, because you're not going to get it straightened out in the time you need to put this on someone. You can actually use the packet itself as a chest seal. So I just keep tape in there as a backup, and tape is useful for a lot of things, including other stuff in this bag. And the last two items I have in this pouch are going to be emergency survival wraps or space blankets. Basically a space blanket on one side and a high-vis material on the other. And this is used to keep your patient warm, to maintain whatever body heat they have when they're experiencing a trauma, particularly a trauma where they're losing blood. It's extremely important to maintain their body heat and keep them as warm as possible. If you're interested in a discussion on the details of why these things are important, like their specific applications, just let me know in the comments, and I'll do a video on each one of these products. Okay, going into the largest compartment here, also the final compartment of this bag. You'll notice here this is empty. In this compartment is where the medications box would go, and it's basically just a box compartmentalized with different medications that we as EMTs can administer here in the state of North Carolina. And that includes aspirin, nitroglycerin, Benadryl, epinephrine, Narcan, and the list goes on. There's a variety of medications we can administer. Also glucose if someone is experiencing hypoglycemia, and there's others. I don't have the box here with me, but this is where the medication box would go. Okay, in this blue bag here, this is where I keep my basic diagnostics. And so I have in here a blood glucose monitor with alcohol swabs and some small gauze, as well as a bunch of one-use lancets. I have a thermometer, sharps container. Actually, I guess I could keep it in here because this is where the sharps would go for some of our medicine administration. A pulse oximeter, as well as a heart rate monitor, a pen light, and I would also carry a pen light in my pants pocket along with the shears and some other things I carry, but this is just where I carry a backup. Oh, I've got a couple of alcohol swabs that got loose in here. Put those back with the blood glucose monitor. There we go. And my stethoscope. I don't carry a blood pressure cuff in here because I have some low-grade hearing loss from a lot of loud noises, gunshots and explosions and all kinds of fun things during my younger years in specialized form of law enforcement, as well as some security contracting I did with the intelligence community. So it's really hard for me to get a blood pressure. Normally what I'll do is I'll get the systolic pressure, and then the diastolic I'll just have to go for a palpitation. So I don't keep one in here because it's an issue for me with my hearing, even with a good quality stethoscope. Okay, in this green bag, this is for Airways. So in here I have just a few NPAs, or nasopharyngeal airways, and then I have a set of OPAs, or oral pharyngeal airways. And I also have some gauze in here just to wipe up anything that might be coming out of their mouth or their nose, and I have some tape in here to secure the NPAs if necessary. At our department, we also carry King Airways. The King LTDs have all the different sizes, they're color coded, and so I know those are available to us in our Airway kits, and they're pretty expensive. We're between $70 and $90 a piece, depending on where you buy them. So I don't keep them in this bag. I use basic Airways, but we are authorized to utilize the King Airway in our county under our medical direction. Okay, let's go over here. Here is the dry sterile burn dressings, and most of these products in here are by North American Rescue. I just like the company. They're based out of South Carolina, about like an hour and a half from where I'm at in the mountains of western North Carolina, and they offer discounts for public safety professionals, and so that makes it easier to stock a good kit to use to serve your community and those around you. And they're also pretty innovative in their design, their packaging, and they have great customer service. So these are dry, sterile burn dressings. They can also be used as cravats or a sling and a swath. But most importantly, these are sterile and they're dry. So if someone has a full thickness or third degree burn, you can cover this and keep any material out of that burn that could cause them further infection. So I keep a pair of these in here for that type of incident. Next, there's a SAM splint, and this one's just rolled, and then I flattened it out to make it fit flatter in here. This is great for orthopedic injuries. I figure everything's about to fall on my floor. This is great for orthopedic injuries to just stabilize someone's wrist, ankle, elbow. You can even stabilize C-spine for that. For orthopedic stabilization injuries, carry a couple of small ACE wraps to secure it in place. And then I also carry one ice pack. And that's basically to reduce swelling and just to help make the patient more comfortable. Okay. In this pocket here, going along with the Airway kit, is a Cyclone BVM. And this is it's a compact bag valve mask. So basically you open it, you can take the face piece out, and then the bag valve mask next, and there's tubing if you want to connect it to a portable oxygen tank. And so with the bag valve mask, you just go ahead and open it up, install your face piece, and now you're able to provide respirations for someone who may need them. And this is the adult mask. I don't carry the child mask in here. If I was going to volunteer at any type of community activity where I knew there was going to be children present and there wasn't going to be apparatus there with the full array of equipment, then I would go ahead and put one in here. I have one right here. Okay. Also in this pocket, I carry some gauze just to wipe away anything that may come out of their mouth or nose. Next, I carry a bottle of purified water, and this can be used to irrigate someone's eyes or to irrigate a wound. And in this top pouch here, I have an irrigation needle that I could use with the purified water if needed. Keep some more gloves in this pocket. Also have a little small bottle of purified water for irrigating a wound as well. And then the reason I keep this in here is because this is also where my eye shields are. And so I carry two different types of eye shields. I have the hard plastic ones with the holes in it, and then I also have the I believe it's called the Fox Shield, and it has a little garter around it for just some extra patient comfort. But these, I just have them. You know, if someone's has some sort of a penetrating eye injury, or they have maybe there's nothing protruding from their eye, but it is injured, I have options as to which one I can use depending on the type of eye injury they have. And I have two of each because if they injure one eye, you're going to go ahead and cover both eyes because you want to minimize their eye movement as much as possible. And then I keep a pair of small rolled gauze in here to wrap the eye shields with. All right, guys, well, that is it for my basic emergency medical technician responder bag. This is something that I use. This is my personal bag. I keep it at home. I take it on road trips. I would also use this volunteering at different community events, whether it be a sporting event or just some type of festival or whatever's happening in the community, church event. This is the bag I would take as a volunteer in those environments. And then as a volunteer at the fire department, I would primarily use what's on the trucks, but I still take this anyway because it's my bag and I know it's in it, and I just like to have it as a backup. So if we end up on some type of scene where there's a lot of trauma, I know that I've got my stuff in the truck that I can utilize if we start to run low on supplies at the scene, because we are in a very rural environment. So you might say, well, why would you use your own stuff? I mean, this all costs a lot of money. Yeah, it does. I mean, this whole setup here is probably, I don't know, well, with the stethoscope, probably, like $400. But we're pretty rural, and the paramedics could be 30, 40 minutes away because maybe they've already transported someone to the hospital from a different call, and now they're restocking and disinfecting and getting themselves back in service. And you have to have the ability to help people, and if you're going to put yourself in a position to help people, do it to the best of your ability. Well, there you have it. If you guys have any questions, comments, anything you'd like to offer that you would do differently or anything you would add, anything at all, let me know in the comments. Enjoy the interaction. It's a lot of fun. Small YouTube channel. I've had a few new subscribers in the last month, and I want to give you a warm welcome. Thank you for subscribing. I really appreciate it. Okay, guys, well, thanks for tuning in, for watching the video. Thank you very much. Bye.